question came up today that I think is vitally important that we get you as many answers as we can give you, because the more you know about your back pain, the more likely you are to eliminate it. But this question is, why does walking up and down stairs make my back pain worse? And it's not just walking up and down stairs. It tends to be walking on uneven surfaces. And, you know, we had somebody said they were walking up a mountain, things like that. Hiking very often will make it worse because it aggravates certain tissues on the body. As you know, I had a severe back problem, and I have more than one problem, so mine was a little bit harder to figure out. But a lot of people have just one problem. We talked the other day about why it hurts when you sit, and that tends to be the bulging disc and the herniated disc. But this one's about why does it hurt walking up and down. And I had a degenerated disc here, I had a herniated disc, I had stenosis, but I also had what's called end plate change, the inflammatory process of the end plate, which is what we call modic changes. And modic changes really are the result of what happens to the end plate. We'll talk about that in 1 second. We have a 10-step process, and part of that 10-step process is having you know what is causing your pain. So we're going to do more of these videos so you have access to that information. Number one, what's causing your pain? Typical spine looks like this, 24 vertebrae between the head and the hips. The vertebrae are the bones. In between each bone there is a disc. The disc allows for motion of the spine. The disc is a lot like a jelly donut in the sense that the outside of the disc there's a thick material called the annulus. Inside the disc there's a jelly-like substance. We call that the nucleus. The nucleus gives stability to the disc the same way air gives stability to your tires. Now, we talked the other day about the distribution of the load being equal in all directions when the center of gravity goes right through the middle of the nucleus. And this is the ideal situation for your disc. What can happen very often is the load can change, and as the load changes, you develop the bulging disc, herniated disc. That was the video for the other day. This is about what happens to the end plate. Now, the disc doesn't have a normal blood supply like a vein or an artery that goes through it. It is supplied oxygen and nutrients through a network of veins and arteries that runs up and down the outside. And also there's a network of arteries that runs through the inside of the vertebrae that supplies the oxygen and nutrients across the end plate of the vertebrae. Now, the end plate, there's a cartilage there that allows for the flow of oxygen and nutrients. It's where all the blood supply is, and what can happen sometimes is you can jam it. Now, in my case, I jammed my sacrum and my L5 vertebrae, and I did damage to my end plate. And when you do damage to the end plate gets swollen, and the swelling will decrease the blood to flow. And there's a degenerative process that takes place if it happens for too long. But as you're walking up and down stairs, you're loading directly into the end plate. And that end plate change is where you get that subtle sort of inflammatory process as a result of the wear and tear, which is kind of what I had. So you get inflammation in the bone, and it hurts. And it hurts when you walk on unstable surfaces. So if you have where you're walking up and down stairs and it's starting to break down and aggravate it, what's happening is you're getting the inflammatory process in here. And that over time will cause a decrease in blood flow, which will eventually lead to the degenerated discs, which is also what I had. We have the ability to solve that. Now, if you have an end plate change, then you need to avoid the activities that are going to aggravate it. So you have to be careful how you load that disc. Certainly any up and down stairs is going to aggravate it, so you have to be careful with that. But heavy loading, like doing squats, sometimes we get patients, yeah, I have some back pain. Well, they have an inflammatory process, and then if you don't calm down that process, it's going to continue to get worse. We do have our top 10 tips. We'll put a link right here for the top 10 tips. If you have the inflammatory process, we also have the SPMs that are very good for decreasing the inflammation. So we have resources for you. So that's why you have pain that happens when you walk up and down stairs, climbing mountains. We have the ability to solve that both in our clinics, and if you have access to the tips, you can start to get your life in order and help put the spine in the best possible position, but we have the ability to solve these problems.